My name is Steve Zeltzer. I'm with United Public Workers for Action, and we're having this press conference here to talk about the continuing problem of privatization and outsourcing at San Francisco General Hospital, particularly the pharmacy. There's a program called EPIC here in Lean, which people will talk about, which is increasing the pressure on stress on workers. It's leading the layoff of workers here at the hospital. And also there's a great problem of outsourcing privatization of not just San Francisco General, but all city services. The city has said that they're going to cut the budget 3% this year, 3% next year. They're hiring more consultants and on outsourcing work. They're spending tens of millions of dollars on more consultants and outsourcing of work. So we have a problem with that. We think that we should be hiring more public workers. We should be defending public services, that the city workers can do this work. It doesn't have to be outsourced. It doesn't have to be turned over to private companies and consultants. Public workers are trying to do the best they can under very difficult circumstances. Really deteriorates the service you're able to provide if you have stress and pressure on public workers. So our first speaker here is Brenda Barrows. Brenda Barrows is the member of SEIU 1021, the chapter chair at San Francisco General Hospital. She's on the bargaining team, and she has been leading the fight against privatization and outsourcing, and also against systemic racism, because the number of African American workers, Latinos, have gone down while whites have gone up in the city and county of San Francisco. So how could that be in this city that talks about integration, that talks about equality and fair treatment of all workers?
I wanted to let everybody know that us, as part of SEIU 1021, we've been meeting with the mayor's office about discrimination within San Francisco. There is data to prove it, that African Americans are fired more often, hired the least, and disciplined the most. This is totally unfair, and it needs to stop. So we have a meeting with yesterday with London Breed, who's putting together a task force to address this issue. While we are thankful for her about that, some of these things that's a long-term solution, I see, but we need some short-term solutions, and we need action right now.
Right now.
So, right now. So, I want to talk about an example of what I'm talking about employees who are in minority classification, mostly minority classifications, how they treated differently and disrespectfully. I have some members of food service here with me right now, and we are in the hugest fight over something that people are probably going to laugh at when they hear it. That what they're doing is they're telling the food service workers that they have changed their policy where they're telling men what color upper underwear t-shirt they can wear. So they find this totally horrible. You have employers walking around looking down people's shirt to see what color t-shirt they have on underneath their clothing. This is outrageous. We believe that if this is what they wanted, then it should have been a part of their uniform. They never have made that a part of the uniform. Now all of a sudden they're doing this, and the way they're approaching employees is in a very harassing way. I have an employee right here who was almost sent home today. Now their uniform, if you look at what she's wearing, is black pants, a black shirt, and they can wear the black vest. Somehow they looked at her today and said, almost sent her home. That is outrageous.
These are the same pants I've worn.
She's worn those for years.
These are my casual workers' pants, and I've worn them for years.
So
and today they put me in the
let
office.
her talk now. So you talk now. You say what's happening to you. Say your name.
No, bring the speaker.
Okay.
Hello?
Okay, now it's on.
My name is Frances
Lee. I work in nutrition department, and today I was almost sent home. I've been wearing the same utility pants. These are casual work pants for, I would say, years. And today they pulled me in and they told me that it wasn't appropriate. And I don't understand why. So this is just harassment that happens every day, and it's getting worse. I've been with the city since 2011. I moved to General Hospital in 2016 hoping it would get better, but it's just gotten worse. There's discrimination every day, there's racism, and I don't see it getting any better. And I don't know where it's going to go, but it has me to a point where I'm actually starting to look for other employment. This past week, I started applying for any other hospital. I know I have job skills, and I know that I have a good heart, and that's what I want. I want to get back to the community. I want to reach out to people and make a difference. And being a food service worker, there's a lot that comes all full circle to that. And just to come here and have people harass me about what I'm wearing is it's a disgrace.
It is very, very, very stressful working in the food service department. I mean, we're so disrespected from the director to the management, and I talk about respect. I try to better the department, and every time I try, it seems as if it gets worse. They passed out this paper last week saying how we were supposed to respect each other and respect management, but then when I said, what about management respecting employees, they said we had to take a sidebar and talk about it later. I mean, really? Talk about it later? Why not talk about it now? And all this with this uniform, at one point I had somebody pull up my pants leg to see what color socks I had on. That's how bad it is. If it's not black or white, they send us home. They want to send us home. If we don't have the right color underwear, t-shirt, they want to send us home. But yet and still, it was never conferred about what color socks or underwear we wear. This is how management come up with all these man-made policies, and we are supposed to abide by them. Now, when we asked for the uniform policy, it's been revised 3 times, and I have yet to get it. I've been with the city for 8 years, and never have we had to wear white or black socks or a black t-shirt, undershirt. Never. I mean, this one guy was literally approached because he had a white undershirt on and said he had the wrong colored t-shirt on, undershirt on. I mean, how ironic. Really. This is what goes on in the city. And all the favoritism, blatant favoritism.
Department where we're having issues right now is, and we filed a lot of grievances about it, and there are a lot of outstanding grievances about it, is the discrimination that's been going on in the pharmacy. It's going on in hiring. It's going on in how minority people are treated in the pharmacy. All these things have been brought to every level of management, and yet still no change. As a matter of fact, these workers are here today to tell you that what has resulted at them speaking up about the problem that they're not hiring enough minorities in the pharmacy, how minority people are treated in the pharmacy is not right, how they discriminate against people by using work assignments and days off and overtime in so many ways, and they're just so arrogant about it. That's why we're here today. So I have Sarah Conrad here and John Wadsworth, both longtime employees of the pharmacy, who would like to talk to you about what's going on with it.
My name is Sarah Conrad. I am a 2450 staff pharmacist as well as a shop steward. I have been at General Hospital for 38 years. I am the most senior, regardless of management or employee, of the employee in the Department of Pharmacy. Yet, management attempts at all levels to be very subtle, as we say, those micro inequities, to actually make me feel, and not only feel, but in record-wise, act as if I am invisible. And I'll just give you some examples. The quarterly meetings. There are always points that are shared on the board with regards to groups and people's contributions. On one episode, there was a naming of all of the employees in the inpatient because we've just moved over recently to this big, beautiful hospital. My name was absent. On one director, when they were giving out accolades about the tenure that you were here. They got up to 15 years, up to 20 years. They were all on the boards with the little pumpkins and all of these sunshine measures. I'm sitting in the room, nothing on the board, not that it mattered, but it mattered when the director reached out across the room to say, oh yes, you've been here for a long time. Yeah, you're the most senior. I don't know whether they ran out of ink, out of pumpkin icons, or what. When I am lead pharmacist, there is also a different behavior. Sometimes we don't have lead pharmacy handoffs. Sometimes there's information that come in, bypassed by me, that goes straight to the board by the management, and act as if I'm not there on biggest day. I am the second, there are 2 African American pharmacists in the pharmacy. I have been treated with so much disrespect, and yet I have been told by some of my colleagues that they see it, they understand it, and that they even admire me because I continue to keep pressing on, as if it's not happening. They wonder, how do I manage in my attitude to continue? I have a work ethics. I came from Georgia, Macon, Georgia, as a matter of fact. So I have Southern ethics. I had a wonderful community, great family, and great friends. But when I came out here to San Francisco in 1967, after graduating from Howard University, I loved every place that I have been. And I came here at General as a reference to an individual who had worked with me prior, who has since passed, but nevertheless it worked for me and liked my ethics and my work. The new management would like to see me gone. Not only for the fact that I have historical information on how you are not supposed to do anything that is demeaning or misconduct or misrepresent the contract. There is a constant violation now, flagrant, contemptuous violation of our union contract and articles that have to do with overtime, that have to do with scheduling, that have to do with the leave, that have to do with maternity leave. There is a rapid, incessant, systemic problem in how management feels empowered to do what they do. And I'm here to say it needs to stop. We're going to be here. I believe in patient care. Nobody is perfect, but we are here to do not only the best job that we can, but even rise to higher levels of efficiency and competency. I expect to always be trained in every product, every system, and even that's short on the stick. So I'd like for people to know they need to investigate. They need to come in somewhat like impromptu and see what they're doing in pharmacy. I have a workload that was designed to break my back. I took it on as a challenge. I'm still taking it on as a challenge. When some people whine about a new assignment, it's moved. I will be here as long as I am able to make a contribution. It doesn't matter whether I get a nickel or dime of Coke or Starbucks. I'm here to do the job.
This is just one example of many outstanding issues that are happening in inpatient pharmacy. The disorganization that goes on in our department is incestuous. There seems to be an effort to take away any type of union rights that people have, and a lot of times if they try to exercise their union rights, they seem to be blackballed, or they lose opportunities to advance. Myself, I've had my assignment eliminated, and taken from me on 2 occasions. I'm a pharmacy technician in the inpatient department and worked in quality assurance for more than a decade for San Francisco, with some, specialized skills in equipment, cleaning, and competency testing. And, it seems as though that their plans to reorganize the department come at any cost. They'll violate federal and state laws around discrimination, laws around age discrimination, and I don't think anyone has really taken a really close look at it to see, what type of emotional and physical damages that people are actually receiving. But I'm hoping that coming out here and speaking on this matter will bring attention and discussions and investigations into the inpatient pharmacy department. And I'm hoping that someone will come in and take a look and see, even though through our reorganization with the EPIC implementation, the lean initiatives, that there is some discussions around civility and compassion, for the workers that are trying to provide care.
My name is Cheryl Thornton, and I am currently on a medical leave due to harm I received in the workplace from the Department of Public Health. I was a whistleblower for pay equity issues, which is, really discrimination against a woman of color. And for reporting that, I was removed from my job illegally with no due process, no just cause. Although my union filed a grievance and we won the fight, there was never an investigation in my workplace, and they wanted to return me to an unsafe workplace to be further harmed. I'm a mother, a wife. I take care of a family. I don't deserve to be harmed in the workplace because of laws being broken around discrimination and race and gender. So I'm here today in protest to stand in solidarity with my sisters and brothers. Again, I've been harmed in the workplace by the Department of Public Health due to illegal practices, employment practices that they currently utilize against people like me.
I have an issue. I'm a patient here. Well, I was a patient here. I'm known for having seizures. I had a seizure at my job, and the first thing they did, I got rushed here, and the first thing they wanted to ask me was I on drugs. I have a history of seizures. So before they even helped me, they took a blood test and a urine test to see if I was on drugs. Nothing was in my system, and they still didn't help me. I had to go in my own backpack and take my own medication for myself. So I'm here today to take my paperwork out of here and go somewhere where they're going to help me with my seizures.
We want to send a message to the mayor who's deciding who will be the next leader of the Department of Public Health. The Department of Public Health is 50% of the city budget. We're the largest department in the city of San Francisco. San Francisco has decided to make an investment in the health of their citizens, and that is a good thing. But we also have to make sure that the person who's in charge of that, who they're looking for right now to be a director of public health, needs to be the right person with the right values to continue that. Because what people fear is that if we get someone who is the director of public health, who is corporate minded, that is the system we will end up with, and that we fundamentally believe that goes against the views of most people in San Francisco. That is not what they want, and they deserve better, right? They don't deserve limited health care because there's some criteria that all of a sudden gets put in, and if you don't meet that criteria, you don't get a certain treatment. We don't want to go down that road. We want to make sure that the doctors, whatever treatment they want to give a patient, they can do it, and we want to continue that. So I'm asking everyone, please make a call to Mayor London Breed's office and let them know, and the Health Commission, and let them know what kind of individual we feel, the ones who do the work, the ones that are on the ground, would be the best person to fill that position. Because we're going to be the ones that have to live under the policies of that individual. So that's a very important decision for all of us and the patients and the services we give. Because how it is now, a lot of people feel like we're becoming corporate, and they don't like it. I know a lot of doctors they feel the same way. But they're being told you have to do it this way. So it's not a choice. You have to do it this way. And so we want to try to turn that around by getting the right person as the director of public health so that doesn't become an issue anymore. That should not be an issue anymore. So please call the health department, call the mayor's office, and let them know what kind of director of public health you feel you need? What qualities do you want to see in that individual? That's very important.
And we couldn't end this press conference without talking about the 800,000 federal workers and 4 million contract workers who are today working without pay. It used to be after the Civil War, they passed Amendment 13, which says it's illegal for somebody to work without pay. It was to fight slavery. Yet they're ordering workers in this country to work without pay. In other words, slave labor. That's what that is. When you have people work without pay, that's slave labor. And we have to stand with our brothers and sisters in the federal government who are suffering terribly because of the government shutdown. And Trump administration want to privatize all that work. They hate civil service. They hate public workers. And the intention is to privatize everything, cut their wages, and have at-will workers. And that's what they're trying to aim for here. Have temporary at-will workers, because that's precisely what happens when you outsource jobs. You outsource to a private company, you don't have the protection of civil service, you have ability to discriminate against people because of their race or sexuality or any other reason. And this is something that we have to stop. And the other thing that we're calling for is we're calling for the supervisors to pass to introduce a resolution against outsourcing and privatization of jobs in San Francisco. We need a statute in the city and county of San Francisco. There will be no outsourcing and privatization unless you have an emergency situation. And because there's rampant outsourcing and privatization, they're spending tens of millions, hundreds of millions of dollars for jobs, of private jobs, when city workers, public workers can do that. So I want to thank you all for joining us, solidarity, and we will continue this fight to protect our public workers, the public workers at the pharmacy in the city and county of San Francisco, all public workers. They need to be supported to have proper public services. Thank you, brothers and sisters.